Lassa fever is not new to us in Nigeria. What is new is that it has continued to embarrass us.
More states in Nigeria move to stop the spread of Lassa fever as epidemiologists warn against possible outbreaks after the disease killed 2 persons in southwest state of Ogun. Right, thanks for joining us this lovely Tuesday and welcome to TVC Breakfast. I am Mike Okwache.
And a very pleasant morning to you. I am Ngozi Alebu. These are other stories we'll be discussing this morning.
We've been able to galvanize over $19 million into the region in just 6 years. Our peace building program has now expanded in the last 2 years.
Peace initiatives of the Buhari administration may have in recent times restored relative calm to the Niger Delta region, and the rest of militants seem to have been kicked out of the creeks. But analysts are hopeful that militancy would not resurface.
The truth, of course, is that without controlling corruption, there is absolutely no way that our economy or our nation will survive.
And that's the bitter truth, as clearly stated by the Vice President. Can the Muhammadu Buhari administration truly rid the Nigerian economy of corruption after a tough battle in 2016? And that's talk time this morning.
Now, TVC Breakfast discussions begin in a moment. You know, I like the way the minister puts it, Minister of Health.
Yes.
Lassa fever is not new to us, but what is new to us is that it keeps coming to embarrass us.
It keeps embarrassing us.
If you look back and see how Nigeria has fought some of these killer diseases, Ebola, polio, and even measles, and all of those, it tells you Nigeria, we've overcome this a long time ago. But
yeah, so what is it about this Lassa fever that keeps coming back? It's become a basket case, just like corruption, and we'll be looking at that too this morning.
Certainly, and it is really embarrassing, like the minister has said. We should be through with this a long time ago. Why is it resurfacing? But we'll talk about that.
Right, to our first big story now. More states in Nigeria are now taking drastic measures to contain the spread of Lassa fever after fresh cases of the disease broke out in Ogun State a few weeks ago.
Now, Ondo State is one of the first states to kick off sensitization programs in boundary communities with Ogun State. And Health Commissioner Dayo Adionju said the government will do everything to prevent the spread of Lassa fever.
That Lassa has been diagnosed in Ogun State and is confirmed. It became imperative for us. Having a state that shares border with Ogun State, we have to quickly sensitize our health workers, particularly at the primary health care level, because to quickly activate the outbreak control team at the primary health care level, as well as even at our state level, the emergency operation became activated. So surveillance, as well as awareness creation, all of those things were things that we quickly had to put in place. And then, of course, we had interaction to see that we do not have case here because, like they said, this year is the worst hit, worse than the last 40 years.
Right, with us in the studio is a medical doctor, Olalikon Makinde. Good morning and thanks for joining us on TVC.
And Happy New Year.
Happy New Year. Happy New Year. Dr. Olalikon, Lassa is still very much with us. According to the health minister there, Isaac Adewale, Lassa fever is not new, but what is new is the continued embarrassment it causes Nigeria. Why is it so difficult to tackle this disease?
Well, I think this has to do with our attitude as a nation. Now we've heard 2 people have died, so everybody will be running scatter. Once we have another 1 or 2 months, everyone will go and sleep. We go to sleep. So that's the thing. We are not maybe proactive enough We only get serious when we have seen 1 or 2 people dying, which should not be the case. And we can see now, in the case of Lassa fever, we already know everything about Lassa fever. It started from Nigeria, from Borno, Lassa village. So there's nothing again for us to look at. And we should also now know that today the world is a global village. So like the case in Ogun State was said to be brought in by a Liberian. And we know that the states that the countries where we have Lassa fever are the same country we had Ebola, Liberia, Nigeria, Guinea, and all this, Ghana and all that. So so the fact that you find in Ogun State means that it could also be found in other states. And I also want you to take note that this disease, that's what we call the iceberg effect. The one you saw is the 2 people that died. The other people that could have contracted the disease that we've not seen. So that means we have to be more proactive in this case. And also, coming back to my constituency, the major people at risk, high risk, are the medical practitioners.
Like in the case of Ogun State, the first the two nurses.
One nurse and the thing is, we're supposed to have the basic protective measure that's supposed to be taken in the hospital. That should be the basic thing that the doctors, the nurses, and the health workers are supposed to have. But if you go to some of our hospitals, they are not there. We are still going back to the same thing. So if the nurses have used their gloves very well, they've used their face mask, they've used all their protective gear, then we will not talk about them getting infected. Even the mortician, the person in the mortuary, if he has used all the things available. But here, maybe the things are not there, and they have to treat the patient, and they have to risk their life. This is what happens in Nigeria all the time.
All right, now, if that's the case, because we have known from the history of some of the diseases that have plagued our people, we know that when a suspected case comes in, since you don't know what the problem could be, you are supposed to take protective measures. And if they're not, the measures are not available, like the gadgets you're supposed to use, the gloves are not there, and the doctors still have to go ahead to treat this person, should we lay the blame on the hands of the medical doctors or the medical practitioners who are supposed to originally take those measures and did not?
It's good that these things are coming to bear, you know. Sometimes a lot that happen in this country is just we have maybe some extra grace. The kind of risk that we take in the hospitals, you need to see it sometimes. I remember when I was doing my my NYC, we had to do a surgery for a woman, and that day we took too many risks. We had nothing. We have to go in there and all that. We couldn't even confirm whether the woman was HIV positive or hepatitis B, and we have to go in there and bring out the baby. When I was in National Hospital, I remember one of my very, very amiable doctors, one of the best in the land, died of hepatitis B. He was a surgeon. And I'm very, very clear that he must have gotten it while doing surgery in the hospital. So these things happen. The doctors, the nurses, the other health workers, the laboratory technicians are at risk. When there was Lassa fever in Abuja then, we had a number maybe up to 5 or 6 of the laboratory technicians were down. They have to be quarantined. Okay, so people, these are the risks that the medical practitioners are going through in this country. And that is why we need to be proactive. My word today for our government, for our ministers, let's be proactive. We always talk about these things when people are dying. When 5 people have died, 10 people have died, but we don't have to be. We have to wait. We don't have to wait to that time.
So, what kind of proactive measures should be in place, and who should be putting these proactive measures in place? Is it government with a budget, which some medical doctors, some health practitioners have said is nowhere near what one would expect to provide the kind of health care that Nigerians need? Let's come back to that as soon as we return from our first break on the show this morning. Stay with us.
Right, if you're just joining us, you're watching TVC Breakfast, and on this segment we are looking at the resurgence or resurfacing of Lassa fever. Now, the Minister of Health has said that Lassa fever is not new. It started from Nigeria in the first place. But what is new is that it keeps embarrassing the country one way or the other. Yeah. How come other countries that had a stint of Lassa fever were able to take care of it? But in Nigeria, it goes and it comes and it goes and it comes. We have in the studio with us Dr. Olaleko Makinde, and we've been looking at this. Now, let's give you some background. Nigerians are on the alert after a resurgence of Lassa fever in the southwestern state of Ogun, where 2 persons have been killed by the disease.
And 396 people who had contact with the diseases have been placed on surveillance. The recent case has again brought to the fore the need for scale-up surveillance system and research on vaccines. Lassa fever is a viral hemorrhagic fever which was first discovered in a town called Lassa in Borno State in 1969.
48 years after, Lassa fever is still a challenge in Nigeria, causing outbreaks in different parts of the country. But Lassa fever occurs relatively commonly in West Africa, especially in Nigeria, Liberia, Sierra Leone, Guinea, and Ghana.
The initial host is an infected multi-mammate rat, and Lassa fever is transmitted to people via contact with food or household items contaminated with urine or feces of the infected rat. It can also be transmitted from human to human through contact with the body fluids of an infected person. Laboratory transmission can also occur, particularly in a hospital environment in the absence of adequate infection control measures like you heard earlier.
Yeah. Now, Lassa fever has an incubation period of 21 days. Some of the symptoms of Lassa fever include fever, that's the name, weaknesses, headaches, vomiting, and muscle pain. Certainly, these are very common symptoms. Now, may also be bleeding from the mouth of gastrointestinal tracts.
Now, the annual incidence of Lassa fever across West Africa is estimated to be as high as 300,000 cases and 5,000 deaths. Now, there are currently no vaccines available to prevent Lassa fever. Prevention requires isolating the persons suspected of Lassa fever by admitting them to isolation facilities. Okay. All right, let's bring in Dr. Olalekun. We've tried to paint a picture of what Lassa fever is and the effects and all of that. But tell us exactly, what are the immediate symptoms? How do you know, apart from fever, muscle ache, it's the same presentation whether you're talking about malaria, HIV for that matter, and all other kinds of ailments. So how are you able to differentiate if it's Lassa fever or not, and which rat specifically?
Okay, that's one of the things about this disease. You know, Lassa fever is just like the symptoms of malaria, or somebody have a typhoid, or Ebola, which I don't want to go into now.
Please don't even mention Ebola.
Or other hemorrhagic fevers. We have what called hemorrhagic fevers.
Yes.
Okay, so the symptoms are look alike, and that's why we still want to preach to people, Nigerians, not to do self-medication, because somebody else might also have had it somewhere and somebody did not know. So maybe they didn't even report it. It's possible that we are talking about Ogun State now because it happened in the hospital. But what about people that didn't go to the hospital in other places, maybe somewhere in the outskirts of Lagos or Ogun State or somewhere? So the symptoms are close to the major symptoms in all those diseases: headache, fever. The only time when you start having more, we start suspecting more, is when the person starts having bleeding and all that. But that can happen in other hemorrhagic fever. And we talk about the multi-mammate rat, which we call the Mastomys natalensis. That's the name of the rat. It's multi-mammate. If you look at the rat, you see a lot of mammary glands on the rat. That's how to identify it. But what we are talking about at the moment, and what leads to more death, is what we call the secondary infection. We always talk about this. The primary infection is from the rat to man, but the secondary infection is from man to man. From time immemorial, when Lassa fever started, the one that caused more death, more fatality, more mortality, is from man to man. And that's why the people that health workers and are at more risk than other people, and people that care for the sick. It's not just health worker alone. I mean, the people that died now, if some other people have care for them and they've had contact with the blood or the fluid or the feces and all that, they could also have gotten infected. So we already know the pathway. But the most dangerous from day one, from 1969, is the secondary infection. So even though as we're looking at the two, we have to look at the two holistically. That's what we talk about. For the health workers, let's protect them. Let our hospital have the right equipment for protection. Let there be gloves, let there be face mask, let there be adequate protective measures put in place in the hospital, and then let's make sure that the people can have what they need to work effectively. And from the primary infection, the major thing everybody have been told about this, It's about we have to prevent the rats from having contact with man. Okay, and that to come to our hygiene level. You know, when Ebola came, everybody started washing hands. But today,
hand sanitizers
everywhere. People are making a lot of money.
That was very familiar in Lagos.
Yes, people are forgetting about hand washing. Okay, and that two are the things we should not. And on part of the government also, what we are doing now in public health, we have what we call surveillance. Surveillance, there are different types of surveillance. What we are doing more now is passive surveillance, which is wrong. We should be doing what we call the active surveillance and the sentinel surveillance. Okay, that means you are not waiting for the things to start to happen. You are looking out for them. Now, if the people have not died in the hospital, you have not find out that anything happened. If they've died somewhere, maybe in one health center somewhere that they couldn't know, you wouldn't know. It wouldn't be in the news. Good old
prevention is better than cure.
Those are the things.
All right. Now, you talked about secondary contact, which is even deadlier. Yeah. Okay, can you break it down? Why is it more deadlier when it is from man to man than when it is from the rat itself?
Yeah, there are many things that can explain that. You know, from rats, we are talking about the feces of rat, the urine and all that, getting in contact with man, maybe with the body of the man and all that, and maybe with the food, because fecal-oral, people eat and all that. So fecal-oral infection, first something is going through the mouth, it's going through digestion and all that. There are many defense mechanisms in the body that could fight against it. But in secondary infection, somebody's blood had contact with another person's blood. So you can see, it's a direct thing. So the virus is going from somebody's blood straight to someone else's blood. So there is no, all those digestion, all those defense mechanisms are not activated. And from day one, we found out that this leads to more
So mortality. The rate of infection is quicker and faster?
The mortality is, it's quicker, because now the contact is between blood to blood or saliva to saliva, which go down into the bloodstream. Or like when it's somebody's fecal-oral, somebody have taken something that can last.
You have to wait for digestion.
The body has a lot of mechanisms to start to fight and all that. And that usually does not lead to mortality as the secondary infection.
And these rats you talk about, I want you to underscore exactly which rats, because I was discussing this with somebody the other day and said it's the big ones, not those tiny ones that just stay small.
Or that live in the house. That live, and they don't pay rent.
The co-tenants. Can you imagine that?
They don't pay rent.
No, but
how can you even tell? You know, you talk about the spotted rats. How close can you get to the rats to know that it's the one that causes?
Yeah, that's why we have to promote hygiene all over the nation.
Especially in a place like Lagos.
In fact, all over the world. Because if it's happening in Nigeria, Benin Republic should be getting ready, Togo should be getting ready, Ghana should be getting ready. What we have now came from Liberia. So maybe we too will now import it to Niger and something like that. The world is a global village, so we have to start talking about hygiene. Like for instance,
was it a Liberian or a Lebanese, they said?
Lebanese or Liberia? I thought it was Liberia or Lebanese. Okay, I'm not sure about that. And you know, what we have is that for instance, the multi-mammal tribe we're talking about at the moment, they are not that much in the southwest. So even the rats to rat thing in the southwest might not be that much. All the infection we've had in Lagos have been imported. All the one we had the last time, some from Edo, one from Kaduna. There was no primary infection in Lagos. Till now, in the southwest, there is no primary infection. All what we have had is secondary infection. So if Lagos say we are clean, or Ogun State say we are clean, and Adamawa is not clean, or Sokoto is not clean, then you are not safe.
We're not all clean.
Yes, because when the primary infection happens in Adamawa, the Adamawa man want to come and be a gate man in Lagos. He travels down with the Lassa fever. When he gets there, he's sick. The boss says, okay, you have malaria, let me try to help you. And by that time, he passed on some things, and the boss was trying to care for the young man, got infected. He's rushed to the hospital because he's the boss. The nurses say, oh, this man should not die. Because Nigerian medical practitioners are very good people. I'm telling you the truth, not because I'm one. They do a lot of things that they are not supposed to do. If some of the things we do in Nigeria, if you do it abroad, the health practitioner will not touch the patient. So many things that people take risks because you have the passion, you have the mind that this patient should not die. I could do everything I can do for this patient. In the hospital, for instance, you have babies who are supposed to be under incubators. They are no incubator anyway. So you see the nurses, the doctors providing water bottles, trying to improvise and all that. This is what we do here. It
brings it back to the question I asked you earlier before we went on that break. These proactive measures that we talk about, where should it start from?
Yeah, it has to start from the government has to provide, the government, I don't like to talk about government, but this time around, we can't run away from it. The government has to start to provide these things in the hospitals, especially the tertiary centers and all that. And in other centers too, the management of the hospital have to provide all these things for the people to use. Let me make you laugh. I remember when we had the Ebola, and then I was drafted to the airport. I was in the airport. I have to do the kind of work I've never done before as a doctor, because this is a national issue. But do you know that I was there, and initially we had nothing to work with, and that's the truth. We had nothing until the day an ambassador fell down. You heard about the news and died. That's when that night a lot of things came out. Oxygen mask came out. The oxygen, everything came out. So where was it before? Because an ambassador have died, everybody's running a task. The life of everybody is important, and I think we have to start to do something about that.
All right, we'll come back to this. Let's go on a break. You're still on TVC Breakfast. We're discussing Lassa fever right now. Don't forget that we're going out on TVC Entertainment, but viewers there can continue with the TVC Breakfast program on TVC Nigeria, on Concert Channel 190 and DSTV Channel 418.
Also, Go TV 45 and ACTV 510. Those are the channels that you can continue to watch the show on. Stay with us.
Right, if you're just joining us, you're watching TVC Breakfast. We're discussing the resurfacing of Lassa fever in Ogun State in southwest Nigeria. And we have in the studio Dr. Olalekan Makinde. We have been talking about this all the while. Now, according to the Nigeria Center for Disease Control, Nigeria recorded the largest outbreak of Lassa fever in its history between 2015 and 2016, with 273 reported cases, resulting to 149 deaths from 23 states.
The World Health Organization has identified Lassa fever as one of the viruses likely to cause an epidemic. No vaccines yet. Now, this is a disease that was discovered in Nigeria by Nigerian medical practitioners. What has happened between 1969 and now that we've not even discovered the vaccine? Are we waiting for the WHO or some US?
I think the day a cousin of one of the governors in Nigeria will be affected, that day, by the next year, you'll get the vaccine. And this is the reality. We always want to wait until when we have one high-profile person dying. It's a country where we feel that one person's life is bigger than another person's life, which is not true. Okay, so now, you know, what we have today is maybe medical doctors, nurses dying, maybe people that are in the rural area dying. So we don't see it as big enough yet. And that's why Ebola was taken more seriously, because it could have affected anybody. The person that brought to Nigeria was a diplomat. So the big men felt that this one can kill us. So everybody was rushing everywhere. So maybe we feel that the Lassa fever, they don't work in the hospital, they can't get infected. And because the issue is this: we can't expect WHO and UNICEF to be doing all the work for us. We also need to be proactive. Who is putting money into the research? People are ready to do the research. Okay, but who is putting money into it? Who is going to sponsor it? It's only in Nigeria that you have people doing research and using their own funds. The salary that have not come in for 1 year yet, it's still the salary you're going to use to do the research, and it's one that will still use his money to pay to publish the paper. Unlike if you go to places where people are being begged to come and do work, and there's fund waiting for you. So these are the things. No, we have to start to look more proactively. No, like the Lassa fever thing, before it was something that usually happened in the northeast, Borno, Adamawa. So people did not feel it that much. But this year, last year, it came something that that happens now in all the other states in Nigeria. So I think right now we should do more about it. For instance, you know today that HIV vaccines in the second stage, and even Ebola is getting more because, but Lassa fever have not gotten that much attention. Although I know some people are also doing some work, some vaccine and all that. So we have to support people that do
in places like the US, you have foundations, individuals actually put in money, whether you're talking about HIV or cancer. We don't get to hear that in Nigeria. Can we really depend on government alone to fund research?
We can't, and that's why the people who are the blessed in Nigeria should start to look more at people who are less privileged. It's something we have to preach. In all parts of the world, people have foundations that cater for other people. But here, you see a lot of people even go to foundation because they're actually looking for what to eat themselves. They are not sincere and serious about the foundation they're doing. And we have a lot of that happening in Nigeria. It's in Nigeria, I see, I'm sorry to say this, the wife of governors or something running a foundation, and you won't see anything really good about it. I'm sorry to use that word. But we need to understand that people's lives are important. If you want to do a foundation, make sure you are doing it with the right spirit. And when you have a foundation, make sure you are reaching out to the right people you should reach out to. So we should have more people coming up, the people that have the big organization in Nigeria, they should be putting funds into this thing. And one of the things that is done abroad is that when you sponsor events like this, when you have a foundation or that, we put money foundation, you get tax rebate. So maybe we are not doing that much of that in Nigeria yet, that people are not doing. But people should be doing this. Companies should be having their CSRs, should be putting funds into catering for things like this, and there should be money for people to do research as well.
All right, let's get back to the rats you talked about. There's a species of rat that is a carrier. Is that to say that outside that rat, other rats don't carry the Lassa fever?
I wish I could say that, but I know that last year there was somebody came up with something that said, okay, even the ratus could carry the virus. Well, that has not been confirmed. Somebody just, okay, I have found out that the ratus, that's normal housefly, can even carry the virus. So, but even though that has not been confirmed, we should also know that it's possible that other organisms might be found to be able to carry the virus. But today, the only one that will be confirmed, and everybody have accepted, is that it's just the Mastomate natalensis, which is the multi-marmate rat. They are usually black. They have a lot of, like she said, you can't look at the rat and say, is this Mastomate?
You have to look for the rat, get into Ngozi's kitchen and like, yeah, this rat, there's a rat here, please check if it has breasts all over the place. Is that the one?
I make sure that the killer instinct in me comes out once I see one.
But talking about rats, I know that in places, like for instance, in Benue State, a lot of people eat rats. In Kogi State, in Nasarawa Plateau State and all of that, a lot of people eat rats. What kind of risks are they exposed to?
Yeah, they're exposed to a lot of risk, especially now that these things are coming up. So, and the multi-marmate rat actually is found most up north. So the Benue State people and all that might also be having risk. But another funny thing is this. In viruses, if you have the contact of the virus, you can actually develop some resistance to the disease.
Okay.
So it's also possible that some people that have eaten the virus, that have eaten the rat, have eaten some part of the virus.
That's the Nigerian
and
spirit.
they've gotten some resistance. So that's why we've not seen so much outbreak maybe from Benue and all that. So these are also possibilities. But generally, we should be careful with having contact with rats.
How about the situation where you cook the rat?
You took it right out of my mouth.
Cook it so well.
So
Cook it beyond 100 degrees centigrade and all the
I
pepper.
I don't even want to talk about
cooking. All the pepper and all the spices.
You have to first kill it. And by the time you are killing it, the blood is gushing out.
Okay.
So you're already exposed.
Okay.
So before cooking it, you have got a lot of exposures. So that might be a risk.
Now, the 196 primary contacts being monitored initially in Ogun State, do we have any news about them?
I think
so far
we've not had anybody coming down. Like I told you before, it's not everybody that's going to come down with the disease. You can get infected and you don't show any symptoms.
So what is it that will make you actually vulnerable to the disease and not the other person?
Yes, there are a lot of things. There's personal resistance that people have. Everybody have different level of resistance. That's why if I'm here now and I cough or I sneeze, everybody might get contact with the virus or bacteria released to the atmosphere. But only one person might come down with the disease because everybody have individual health level, their own personal resistance. They might be diabetics, they might be hypertensive, they might have some they have some disease that work on their immune system and all that. So that depends on individual. There are people that can, like the case we had in Lagos. I was part of people that managed the case in Lagos, the Lassa fever, the last one. Actually, I was part of the team then, and the patient, the brother actually had a contact with the patient. In fact, he touched the blood, and I was like, this guy might go down. And every day in the hospital, and the patient was admitted in the loot, the brother is always walking around, and I see him. I say, wow, this guy is having contact with everybody. Well, the only good thing about Lassa fever is that when you start having a fever, you cannot transmit it. But it never came down. He touched the blood. He touched everything. It never came down. So it's individualistic. One person might come down today, the other person might not come down, even though he has that contact with the. So he cannot predict who's going to come down or not. That's why you have to make sure there is universal precaution. Just like also the hospital where the young man was first admitted. The MD at the time was having some kind of fever. Everybody was afraid maybe he's down with Lassa fever. But by the time we did the test, he was not. The Ahmadiyya hospital of that. So it's individualistic. One man might contract the disease, might not come down, but might transmit to somebody else who will not come down and die.
Okay, now in a situation where you discover someone has, for instance, the 140-something people that are under surveillance, if someone comes down, what do you do to the person? How do you manage that the person doesn't die?
Okay, now once somebody...
Because we know there is no cure necessarily. Is there a cure?
No, we have it can be managed. Okay. We have a drug who can help the management, the ribavirin, which is available. And even sometimes people that have contacts, some of them might even take prophylaxis. We have prophylaxis also of ribavirin. So once somebody have a contact, the person has to be quarantined. Quarantine is that you are not yet confirmed to have the disease. That's what we call quarantine. But once the person is confirmed to have the disease, the person has to be isolated.
Okay.
Okay, so nobody have contact with the person until the person is treated and confirmed to be negative. So people that have had contact, most of them will not come down. That's why what you do for them, it's very easy to contact trace people that have had contact for Lassa fever. All you do for them is just give them thermometer to check their temperature. That's what we did. I remember then in Lagos State, I was also part of that team. We were all over the place. Kurudu, we are in Ikoyi, where we had cases. We were in Festac, where we had cases. In fact, we were in most of the local government, because each of the local government will look for people that had contact, and we also grade the contact. There's primary contact, there's secondary, there's third degree, there's fourth degree. So you want to look at all of them like that. If this person have had the contact, I want to give him a thermometer to measure. If his temperature is still like 36 point something, you are safe. But when you start having temperature of 39, you know that person has to be isolated. Then you have to take the blood sample and then go test in the lab. And sometimes, even after having that temperature, you find that some of them actually do have Lassa fever. You know, sometimes your mindset, like the person that had the contact, you just feel, oh, I've had a contact, I want to come down. And before you know, the person start having temperature.
Like so, when you're going for blood pressure test, you know, just...
Yes, you just start to develop BP. Yeah.
Now, how long does the evaluation last to actually ensure that this person is in the clear, they don't have Lassa fever, the possibility of infecting another person is totally nil?
Now, you know, the incubation period, maximum incubation period for Lassa fever is 21 days. So you have to, according to definition, that will be 2 times that. So 42 days usually is what you monitor them for. So after 42 days, you are not down with fever, you are not having any symptom, you are off the...
All right, Dr. Olaliko Makinde, thank you very much for giving us this enlightenment. We'll keep following up and letting people know what they should do when it comes to habits and so on. Thanks for joining us this morning.
Thank you very much.
Thank you.
Have a great day ahead.
Thank you.
All right, stay tuned for the next topic we'll be talking about shortly on TVC Breakfast.
Right to our second big story now, looking at the Niger Delta and the promise of peace. Now, the neglect of the Niger Delta region, despite years of oil exploration and profit from oil sales, gave rise to the emergence of many militant groups who carried arms against the government, demanding fundamental development in the region and their share of the proceeds of oil exploration.
Now, these groups have claimed responsibility for the destruction of many oil installations and pipelines in the region, and their activities has cost the nation billions of dollars in revenue generation, and past governments have tried to put an end to militancy in the oil-rich Niger Delta region through dialogue and other means, but recorded no success.
Now, let's reel out more information on that. The creation of the Niger Delta Ministry, the Niger Delta Development Commission, also known as the NDDC, and the introduction of the amnesty program by late President Umar Musa Yar'Adua in 2009, when militants agreed to put down their arms, were all measures taken by the federal government to bring lasting peace. The program, meant to end within 2 years after the militants were rehabilitated and integrated, has now entered the 8th year since its introduction, and still the problem of the region remains.
Let's take a look at some moves by the government to bring peace to the restive region. In 2015, the federal government allocated the sum of 36 billion naira as allowances for transformed ex-Niger Delta militants under the amnesty program. The amnesty program in 2016 got 20 billion naira as a result of Nigeria's economic struggles. Now, the huge leap in allocation for the program, as revealed in the proposed 2017 budget, shows that government's readiness to resolve the issues, and the amnesty program is ex-Niger Delta militants under the amnesty program. The amnesty program in 2016 got 20 billion naira as a result of Nigeria's economic struggles. Now, the huge leap in allocation for the program, as revealed in the proposed 2017 budget, shows that government's readiness to resolve the issues, and the amnesty program is to get 65 billion naira for the rehabilitation of repentant militants. And Niger Delta Ministry, 33 billion naira, and the Niger Delta Development Commission, 61 billion naira.
Now let's listen to President Muhammadu Buhari during his 2017 budget presentation and his plans for the region.
We will continue our engagement with the community in the Niger Delta to ensure that there is minimum disruption to oil production. The National Assembly, state and local governments, traditional rulers, civil society organizations, and oil companies must also do their part in this engagement. We must all come together to ensure peace reigns in the Niger Delta.
All right, we're joined now by a Niger Delta activist. He is the publisher of Ijan News, and he is also the coordinator of Nigeria Without Borders, Presido Gomorai. It's good to see you this morning. And Happy New Year.
Good to see you.
Right, you just heard the president there. He said, first of all, I like to take this from the Niger Delta, from the eye of the Niger Delta. Yes. He said that traditional rulers, states, civil society organizations, communities all have roles to play. Yes. Now, let's leave out what the government is supposed to do that didn't do. This time around, let's start it from the eye of the Niger Delta. What can they really do to say, well, there has to be peace in the Niger Delta, and then let us see how we can make ourselves prosperous?
One, there must be sincerity of purpose, and we must tolerate ourselves. And the government should, this time around, open its ear to the leaders of the Niger Delta. We have leaders, and there are leaders. But the truth is this, in any circumstances, some persons will have that privilege. What we are saying is, on our part, we must tolerate, because you don't expect government to be perfect. These are the things, tolerance, and we must be sincere with our agenda. Because the media particularly has been used to run down most leaders from the Niger Delta, which is unfortunate. I can't say I'm a leader in Niger Delta, but at my age, I'm over 60. I know what happened and what led to whatever you are seeing on ground. The government on its own part too must be sincere in tackling. The idea of encouraging 2-3 persons to go and do should stop. Let government, like we did to Abuja, let government to be committed in releasing and then going on ground. I give you a very sorry sight. I come from a particular community where there's only one bank. Now you know what the influence of bank in the business environment. Only one bank. And it's so all over Niger Delta. Apart from the state capitals and probably Warri and Ughelli, all other communities are completely denied of anything called civilization. And that's why you see the youth of recent time are thinking that there is social change, so they have to fight back. Some of us, we are not that we are lazy, we thought by crying out. If I tell you I started the Ijan News, the first tabloid in the South, when we saw the truth, because I was born in the North, grew up in the North. I'm more familiar with the North. My first visit home, I was shocked to find out that you don't even have water. You go to the river to fetch water. Where you defecate, the same place you see cups floating, you only push the cups away and take the water. That's how our people were living. So awareness gradually came in, and things are, the government should be sincere, and our leaders too should address issue frontally.
When you say government should be sincere, yes, there was this meeting on the 1st of November, yes, between the president himself, yes, and some leaders of the Niger Delta. Good. Would you still say that government doesn't seem to be sincere, especially looking at the 16-point shopping list, yes, that these people, yes, you know, went to the president with? Of course, recently President Buhari said, you know, that his administration was working hard to persuade the leadership of the Niger Delta to agree on, you know, how to manage the oil resources, yes, instead of resorting to fighting. Yes. So what do you make of all of this?
You see, I started by saying the government has to be sincere. That tells you that there's this element of government using the people against the people.
How?
Just after that meeting, we had of another meeting where a set of youths again and leaders again met with the vice president. Are you not aware of that? Then you see there's a divided home already, and we are human beings. If I'm leading a team, and tomorrow you invite another group again to come back and discuss something else, it tells you that there is insincerity. If government is sincere, those agendas listed out, you added 5, 16. Key ones, I just mentioned banking. If the oil companies relocate to the locations where they're operating, what will happen? The banks too will relocate there. And if you have banks, I mentioned communities, I won't mention the banks. But I tell you, I operate to a particular bank. It doesn't exist in Uganda. I come from Patani. I need to be in Warri to operate in my bank. And it's like traveling. Meanwhile, I live in the Abeokuta Expressway. You have my bank operates in a different location, about 8, and that axis. So you see, you have these people who now want facilities and they're not getting it, like education. And then the next thing again, you see the media too is not playing a good role. What they do is they pick on one individual. I'll mention that case. They'll pick on Alhaji Asare having a university outside Nigeria. We know Nigerians who own universities outside the country. So many from other tribes. But they pick on, once it's Niger Delta, they use it as a good example. You want to rubbish our people.
Well, but the point there is let's look at this very critically. But let's look at this very critically. Okay. Like the case you just mentioned now, for instance. When you come out and say, our people lack this, our people lack that, and you are ready to destroy government property, you're ready to even kill, if possible, if need be, to protect your people, and you have resources enough to be able to set up any kind of investment or anywhere, and you take it outside, won't other people see you as hypocritical when that kind of case arises?
You're not looking at it holistically.
Okay, let
me give you. Do they even have the funds to meet the demands of the institutions? They don't.
Okay.
What do we have in other parts of the country? We have public institutions. Why not set up public institutions that will not meet up our... Look, the private universities outside our areas, we can't even meet them in there. So where he gets his money? We know of the private universities in the southwest. They are mostly in Lagos, because the people can afford to meet the demands. Those who can afford. But when you put one in our creek, not minding the cost of even keeping the lecturers there, who will come and pay for school fees? Look at even the Maritime University that was, I think it's God's intervention. Conceived idea, and somebody negotiated to buy a property, convert it to a maritime university that we don't have in the country. Maritime is not aviation. Yet, people from that part of Nigeria moved against it. So it's like they know we have our weakness. So what do we do in Nigeria? The government, when I say sincerity, they go into our own brothers, our own leaders, and use them against our leaders. So all the time it's just like the crab. You keep the crab in a basket. You open the basket. They keep pulling themselves down. That's just where.
Do you think that is what this government is doing?
If the government is sincere,
that had this meeting, hold on, the youth that had this meeting with the vice president.
Not the youth, only leaders.
Well, especially the youth. They were said not to be part of this original meeting that happened on the 1st of November. Isn't that a way of having them be part of this process too?
It's the leaders that really determines and takes the pace. You carry the youth along. You can't ask youth to come and hold a meeting where people at my age and the youth go to I'm not saying I should be the one, but we're thinking we have people. I can mention 10 names that featured in that meeting, and they are credible people who had made impact socially, physically, spiritually in Niger Delta. You can't just pick some persons who are also agitating to become one person. I never once contest an office. But I think we need to make our contributions through the appropriate quarters.
Now, in this kind of situation where credible leaders, you said you can mention 10, and there were so many of those leaders who
attended that meeting.
At the time of even attending that meeting, we had people in the Niger Delta who were saying, no, we don't like...
They're not our representatives.
They're not representing us. If you have that kind of situation, don't you think Niger Deltans need to go back? Because if there is room where anybody can take advantage of us, anybody can come and use this against this, that is the undoing of the Niger Delta, don't you think so?
No, I just told you, I said, if I'm not involved, does not mean people who went there are not credible. And you don't forget, it's not only Niger Delta, it's a typical situation in Africa. Once you are not getting it, you condemn it. That attitude must drop. That's why I said we have to tolerate ourselves. That's the fault of our people.
How do you think that is impacting...
Come again?
Yeah, how do you think that is impacting negatively on the Niger Delta getting what it
And that's why
really
the outside world just believe that we are not organized. We are disorganized.
But maybe that's true.
It's just like the Southeasterners. Today, everybody sees Carlo. I think it's Carlo also. Is detained. Courts have granted him bail, yet the government of the day refused to. How many of our people from the east have come out to say, look, rather they want to condemn him. But you see, gradually people are seeing the facts. You see the play out of government today. People from a particular section of the country are not seen as progressive. So you are denied. Even see the offices. Today, if you see anybody, key persons talking on behalf of Nigeria, you know a particular section of the country comes out.
But do you agree with the president when he says that there are no quick fixes to the Niger Delta problem?
There are no quick fixes, but there should be some monumental activities that will show that they are committed. Like one, very vital, let the oil companies all relocate to the oil producing communities. With that, you show that the people will now know that there is this element of sincerity in government agenda. Otherwise, almost, I won't mention the names, they are all based in Lagos, and the company law, except they change it. Company law says you pay your company tax where you have your headquarters. So what they do is they will go by helicopters to your rig, your location, on Monday. On Friday, you take off again back to your communities. What do they do? The oil workers abuse our daughters. In the history side, you go there, you see, I even have one, a Chinese look-alike. Only God knows how. Because they come operate.
What do you mean abuse? They marry them?
They don't. If they marry them, it would have been better. We'll see our children, our daughters in China, in Japan. It's abuse. They abuse them. Use money to, because you know now, oil workers are always loaded. It's unfortunate. And then you look at employment rates. Let's be honest.
Okay.
Employments are conducted where you have headquarters.
All right, President. Yes. All right, President. We'll come back to this. Let's go on a break, and we come back on the program. And don't forget that top of the hour, but time for us to go for the news update, where Ikechukwu BN will be taking us there. But let's go on a break now. Stay with us.
Right, we're looking at the Niger Delta, the promise of peace. Will there be peace in the Niger Delta in this year, 2017? How achievable is it? Well, our guest right here in the studio is Presido Gomorai, coordinator Nigeria in the eyes of the South-South. He's been talking on this with us. But very shortly, we'll be joining Ikechukwu Obieno, who will be giving us the news update at the top of the hour.
Yeah.
8 o'clock.
So we'll be talking about, we'll be going to the news update, but the point there is one thing in the Niger Delta that we're talking about is, you see, where President was talking about sincerity on the side of government on one hand. A lot of Nigerians...
Kind of degradation, whether you're talking about environmental impact of the oil exploration that's gone on there for so long. So you can understand why some people will be like, you know, why do these people keep, can't they just be satisfied with everything that government has put in place?
And that's why
NDDC,
they call
Niger Delta Ministry, Amnesty, and all of that. And now in the 2017 budget, you have, you know, an increase in the budget and all of that. But are all this enough really to solve the problem that is the Niger Delta?
Well, we'll talk about all that. Right, if you're just joining us, you're watching TVC Breakfast, and we are discussing finding lasting peace in the Niger Delta. That's what we're talking about right now. We have in the studio Presido Gomorai. He is the publisher of Ijon News and the coordinator of Nigeria Without Borders. He's also a Niger Delta activist, and he's been in this for a long period of time. Now, Presido, when it comes to what the Niger Delta is entitled to, a lot of people have a lot of Nigerians have different views as to why are they so pampered when you have a ministry dedicated to them, when you have NDDC doing this for them, when you have 13% derivation already, the agitation are not to the right people and all of that. Now, can you make us understand, in all of these agencies and institutions of government set aside for Niger Delta, over the years, how impactful have they been in lifting Niger Delta to where it's supposed to be?
Sincerely, except we want to be funny,
which we won't be.
We won't be. We must appreciate the fact that they've done so much, but not good enough to make the people go down in their agitation. They've done so much. Considering the fact that, don't forget, it's a Nigerian factor. Every day I was shocked. I saw figures we are reeling out. we will have asked those who operate those commissions, agencies, ministries, do they actually get so much money that we are being told, the public is being told? No. Even the amnesty program. As I speak, I know the role we play to pacify. For some of them, they think we have been, they've settled us, so we are always, no. We're thinking that we need to really address issues. I even pity the coordinator and special advisor to Mr. President Nigeria, General Boro. I pity him. They keep calling us every day and abusing him. Meanwhile, he's trying to pacify the situation. Government must be sincere. If you say 10 naira is due to this, we'll give the 10 naira out. That's the truth. A good number of the agitators, ex-agitators, are supposed to be on a particular stipend. They are being held about 5 months now. And you see, the presidency will come and tell you there's so much, and they will use some of us who are in the media to tell them they are releasing this much before this. Meanwhile, nothing is done. The truth is, it's not only peculiar to Niger Delta. Yeah, you see, there's this Yoruba adage I use. I'm not a Yoruba man, but you say, "Mama kpe aja lobo fun wa." Aja is aja, obo is obo. Meaning obo is monkey, aja is aja. What the government does is they call dog monkey. It's not fair. Okay. We must be sincere.
The dog should be a dog, the monkey should be a monkey.
Yes, and the moment the citizenry finds that you are telling the truth and what you have said is what is reflected, they will reconsider and say, look, things are not easy. So let's have.
So would you appreciate Mr. President when he says he wants to get to the root of why the Niger Delta problem has persisted over the years, in spite of all the measures, whether palliative or otherwise, that have been put in place, you know, all these years? Yes. He needs to do that, doesn't he?
Yes, the truth is this. I just said it's sincerity. Mr. President, with all due respect and regard we have for him, we know his antecedents. He cannot tell us he's just forgetting to know about Niger Delta. He was once in charge of NNPC, he was once in charge of petroleum. And then he will have done this now. So the truth is this, we're not being sincere to the people of Niger Delta. Simple. And particularly the media. I just have got involved.
You keep putting it at the doorstep of the media. Exactly how is the media involved?
I'm shocked that you even
okay, you said they're not. You said they're not telling the truth.
True picture outside.
What is the true picture?
Look at what happened some couple of days back in the southern Kaduna.
Southern Kaduna.
Before the media gives you a figure of 808 dead bodies, we saw pictures on social network. People massacred. But the media have been silent. It's only the social network and some few persons have been highlighting it. In the case of Niger Delta, I give a case. I was in the program, I said it. I'm very sorry, but the truth must be told. There is a traditional religious leader who had problem with the chief of army staff. And we had the court granted him so much money. How many million? To go in the next 48 days or so. They must build him a home because he's unlawfully detained. Do you know how many Niger Deltans have been killed innocently? How many in the process of Navy having shootout within themselves, just not shooting, no, training, they kill our people. You just go to Niger Delta, it's militarized. We get to some part of that area where you go into some villages, you get to an area, you answer up as a captive. You answer for the next 1 hour. You treat us as if we are third class, fourth class.
So going forward, this is a new year, yes. And hopefully government is looking at how to...
say he doesn't know because he has been in charge of petroleum.
Okay, so now let's assume the president does not know.
He should not
what are the sustainable, the immediate and sustainable solutions?
Even if they are criminals,
going forward,
go back to those leaders who had started this agenda. The leaders are known. Unfortunately, the likes of Oronto Douglas has passed away. They are there. Identify them. I don't need to. I mentioned somebody like Tiko Goriba. You go to look at the Ogoni issue. You cannot tell me you don't know about Nidin.
When you keep talking about government engaging with the leaders, let's assume government needed to engage with the Southeast or even the Southwest. Does government need to deal with the leaders or already knows what these people need and so just provides those things?
You know the leaders and you know what the people need. That's where they know what the people need. They're not asking for everything. The oil companies relocate to this. Then if I am doing cleaner work for the oil company, they pay me. I am sustained.
But there are instances.
Today, oil companies are all, headquarters are outside the location.
Yes.
They fly in, abuse. I just give you a good example. Abuse our daughters. Abuse our boys. They even encourage the boys to go into criminality. How? They empower them. to fight against themselves.
We also hear of times where youths also hold companies to ransom, tell them to pay certain monies before the equipment will get to, and all of that. So when you have situations
because you are
like
not putting the right pegs on the right steps, so the boys will go extra mile to get something.
So-
I cannot
so-
live in
so
an
when
environment. I see the goodies that make this country. I give you example. You have Shagari Estate, Gowon Estate, Satellite Town, Festac Town. If you had built one in Amabulu, I mentioned names of places you have not been to. And these are the places that produce oil. Nothing to show, not even health centers. And you ask people, how do you survive? By the will of God. It's unfortunate. I'm not talking about worry. Okay. I'm talking about Pretorbeni. I'm talking communities when you get to, you'll be shocked and amazed that you come from this is part of Nigeria. I don't even believe the census, people who do census go to those communities to even count the people. That's why we're shocked when they say minorities. For the average 10 persons in Lagos, 4 are from Niger Delta. If you count random
that's very arguable anyway.
Yes, arguable, but I don't have a right to.
No, it's all right. It's okay. But when you have a situation where the Niger Deltans are complaining, just like you said, and the oil company, they come, they abuse their daughters, they do all of those, and then the companies themselves also have complaints. Sometimes youths come, hold them to ransom, sometimes even kidnap their children and so on, and sometimes also blow up pipelines, sabotage deliberately. Now, when you have that kind of situation, you against us against you, would you blame the companies for leaving the Niger Delta?
You blame the companies, because if you have a platform that is ideally an open-minded operating, the people themselves will rise against the criminal culture people there. That's criminality. For me to fight criminality, I must see a committed group I'm fighting for. We're human beings. We're human beings.
All right. Prosidor Gomorai, coordinator, Nigeria in the eyes of the South. Thank you so much for being part of the show. But of course, the president has said for peace and development to happen within the Niger Delta, the leaders have a lot of role.
And government, not only the government in particular, not the leaders, the government.
No, everyone has a role to play.
Thank you.
Thank you so much.
All right. We're not identified.
We'll take a short break now and return and talk about corruption. Stay with us.